Hello, everyone. Welcome to Avant Live. And my name is Adam Kless. I'm Vice President of Clinical Operations for Avant. And with me today is Erica DeMoss, who is the manager of the Clinical Transitions Program that you're going to be coming to in Orlando very soon. We're here today to give you a tip on how to be successful as a U.S. nurse. And really, the number one tip is really talking about the autonomy of a U.S. registered nurse. So in the United States, the registered nurse is the eyes and ears of the physician. Physicians are not in hospitals 24 hours a day all of the time. Nurses are relied upon to apply their skills in assessing patients, in determining the outcomes to interventions that were applied, and looking at the responses to treatment, and then reporting it back to the physician. So we play a critical role in healing patients. And what we've seen through having thousands of nurses come through our program is some common themes. Some themes around autonomy where you may not be used to giving a doctor recommendations. As a nurse, Eric and I are used to giving recommendations to physicians based upon what we've seen. And you may be used to just waiting for the doctor to tell you what to do next. But in the US, we're expected to think through the situation, think holistically with your patient, and then be critical and speak back to the physician in a professional manner about what you've seen and also what you think might be an appropriate intervention for that patient. Erica, I know that, we talk about autonomy and we also, focus on from a cultural standpoint that nurses in the US we are more assertive.
Absolutely.
And in many cultures that our nurses are coming from internationally, it's much more of a respectful position to a physician. Talk to us about what they're going to learn about appropriate professional assertiveness as a registered nurse.
Well, absolutely. That is a big theme that we see here as nurses come through, and it's something that we work a lot with. We tell our nurses frequently to think like a doctor. Now, that doesn't mean to act like a doctor, but to think like a doctor. Anticipate your patient's needs. Take all of your assessment data that you've gathered, synthesize that, and kind of figure out what you think might be going on with the patient, what your patient may need. And that's where those recommendations that you spoke about came in. When we talk to doctors, like you said, they're not there. So we can't just go find a doctor. We have to kind of think through things, troubleshoot what we can, go through our orders, and then as the last resort, that's when we're going to call our doctors. So we teach our nurses and work with them about thinking like a doctor, try to figure out maybe what's going on, anticipate the orders that you might receive so that if you don't get all of those, we also encourage you to be assertive and to ask for those. Like if you have a patient with nausea and vomiting that's just started and you anticipate getting orders for pain medication, an MPO order, lab work, IV fluid, maybe some type of radiology exam and an antiemetic, you call the doctor and they give you your orders, but they don't give you anything for an antiemetic. Our nurses are empowered to speak up and say, well, my patient is still nauseous. Can you give them something for an antiemetic? And for the nausea. And a lot of our nurses are really uncomfortable with that at first. So we work with that a lot. So, I would definitely encourage you to, start kind of thinking about those things. When you're taking care of your patients at home, think, if something's going on, before you go to the doctor, what do you think they might order? Try to get those in mind to help prepare you for when you come here.
Now, I know, nurses were the most important person in the hospital.
Absolutely.
We're the 24-hour-a-day constant for our patients and keeping them safe. Now, one of the things for me, even having managed nurses for many years, especially my new grads, they would work night shift and they'd call a doctor at night and they would get kind of chewed out a little bit by the doctor because they didn't have all of the information that they needed. Can you tell our nurses that are around the world how we prepare our nurses to be assertive, but also how to be prepared when you're calling a doctor?
That's a great question. So one of the things that we do with our nurses here is we work on obviously assessment skills, but also using an SBAR format for talking to physicians. So that is going through, identifying what the situation is, kind of the background, all the pertinent assessment details to kind of support what you think is going on. And then finally, that recommendation part of it. So utilizing that framework really helps you to kind of critically think through things and also communicate the information that you found.
That's a great tip. So I hope that this tip that we've given you today has really started you to think, and I hope you're able to start envisioning what it's going to be like for you to practice nursing in the United States. There are a lot of things that you can do while you're waiting to come. You can go online and research SBAR, S-B-A-R. It's a type of communication we use in the United States. You can also research bedside shift report. You can also research professional communication in a hospital. You can also research interdisciplinary relationships, all things that you're going to be expected to know. So your learning isn't going to start when you get to Orlando. Your learning is going to start now. So continue your journey, come to us really well prepared, and we'll make sure that you have a great, successful experience here in the US and that you realize your American dream.